And for you, as we'll talk about as the course wraps up here, continuing coming to the weekly group consultation meetings, right? If you have new clients, they have unique presentations, not suffering in silence here, okay? Bringing it as a member of the DBT Sleep community, and we can go through all of this together, right? Doing this as a community of DBT Sleep clinicians, helping each other and refining this moving forward together. All right. So that will be for Megan. Just continue implementing this flexibly moving forward, and that completes that home practice review. So now let's turn finally to an updated summary of Megan's treatment progress. Okay, so let's go back to kind of square one here and remind ourselves, we've talked about where we are, let's remind ourselves where we started here with Megan. So going back to, the assessment handouts here, we can start with name and date. So Megan, she's in her early 30s, okay? Her current sleep difficulties, and as we're going through this, you may kind of make a mental note of, all right, this is where, she was, this is what she learned, where she ended up. It can be illuminating to reflect on, right, the progress that happens in a relatively short amount of time, okay? So current sleep difficulties. I've had trouble falling asleep and staying asleep since childhood, around age 6. I've been using sleep meds for the past 18 years. I'll sometimes take Benadryl, drink alcohol, or use THC for sleep when I don't think I can sleep without sleep meds. Even with sleep meds, I still wake up feeling groggy and unrefreshed. I sometimes wake up feeling like I'm trapped and I can't breathe. I'm often afraid of sleeping, and I struggle with shutting off my brain at night. When did these begin? From about the time I was 6. I don't remember the month. What do you think may have caused these sleep difficulties to begin when they did? Physical and sexual abuse in childhood for as long as I can remember. The sexual abuse would often happen in my bed and bedroom. I remember being punished and physically abused if I slept in on school days or on the weekends. I thought about killing myself a lot, and these thoughts would often get worse at nighttime if I was the only one awake in the house. And what have you tried to manage your sleep difficulties? So, medications, Ambien, Lunesta, gabapentin, trazodone. She noted recently stopped trazodone when she started Ambien. Benadryl, temazepam for anxiety and sleep. Alcohol and THC. And in terms of behavior changes, counting backwards, taking a hot bath, using essential oils, some meditation. She noted trying to clear my mind. Not really a consistent practice here. Trying to do less screens around bedtime, less caffeine in the day, and less bright light before bed. Okay? And how is she currently managing her sleep difficulties? 10 milligrams of Ambien, sometimes Benadryl, temazepam, 15 milligrams for anxiety and sleep, alcohol and THC, and these same behavior changes that she listed before. And so revisiting Megan's sleep treatment goals. I want to be able to regularly fall asleep and stay asleep without sleep medication. Maybe get 6 hours of sleep each night. So I also want to have less fear of going to bed and to be able to clear my mind at night. So now let's take a trip down memory lane here and go back to the session 6 content where we did handout 6, the review of skills and treatment progress. So session 6 revisited. Review of treatment progress, and did she accomplish her sleep-focused goals? Well, here are those goals we just covered. Regularly sleeping without meds. At session 6, she noted no Benadryl, no temazepam, using less THC and alcohol, and the Ambien taper was ongoing. Maybe getting 6 hours of sleep each night. She had increased from 4 hours to 5.5 hours, and that was still ongoing. Less fear of going to bed and clearing her mind. She noted yes, less fear and not clearing the mind, right? Those B plant skills. So let's go ahead and now update this here at our session 10, right? 4 sessions after this time where we did the initial review of skills and treatment progress. So, regularly sleeping without sleep medication. Once again, here is our summary over time. And as we noted, now falling asleep in 26 minutes here, no Benadryl, no temazepam, less THC and alcohol, and now we have no Ambien here. And this is after 2 weeks, right? This is 2 weeks of zero Ambien. In terms of middle of the night awakenings, well, 14 minutes. So we are regularly sleeping, right? Staying asleep, no Benadryl, no sleep medication here at all. Sleep efficiency, Well, 88% here, again, on the second week of absolutely no sleep medication. And sleep quality, still at a 3.3 out of 4 here with no sleep medication. So that is our updates now on Megan's, regularly sleeping without sleep medication. She has now accomplished this treatment goal. All right, so what about total sleep time? Maybe getting about 6 hours. We had increased up to around 5.5 hours at the session 6 mark here, and it was still ongoing. Now at session 10, we can see we're at 6 hours and 19 minutes, the highest that we've been on the second week here with no sleep medication, and that showing, right, the treatment progress over time. And then finally here, less fear of, going to bed and clearing your mind, less fear, not clearing the mind, those B plant skills, moving forward, reminding ourselves of these: beginner's mind, patience, letting go, acceptance, non-judging, trust, and non-striving here. And for Megan, this is still an ongoing process. I mean, for all of us, right? Applying mindfulness, we never check the box of being finished, being mindful, right? This is this ongoing practice and way of being. And so continuing this, general framework here as applied to sleep disruption and insomnia for Megan, for yourself, for myself, right, moving forward. Okay. In terms of the assessment measures we have, the Insomnia Severity Index starting at clinically severe, 26 out of 28, and ending up here at a clinical absence, 4 out of 28. Daytime sleepiness, starting in that low normal range of sleepiness. Once again, that tired but wired type of a phenotype here for Megan. Definitely tired and exhausted. Not a lot of daytime sleepiness, as we've talked about. Hyperarousal, hypervigilance, potentially masking that sleepiness, right? So over time, here we see the graph ending at a 0 out of 24, and then that little bump, right, when starting that ambient taper there at session 5. All right, in terms of those subjective symptoms of depression using the PHQ-9, starting out at that clinically severe level of depression here, 20 out of 27, extremely getting in the way of the life she wants to live in terms of daytime functioning, with SI there at a response of 2, and then ending up in a 5, right, out of 27, clinically minimal depression, getting in the way instead of extremely somewhat, and still having some SI. So continuing to check in on suicidal ideation, risk for self-harm, moving forward in DBT treatment. And here's that progression over time. And then finally here with generalized anxiety, starting out in that clinically severe range, 16 out of 21, extremely impacting daytime functioning, and ending here at 6 out of 21, clinically mild range of anxiety, and going from extremely to somewhat, right? Getting in the way, in terms of daytime functioning, and there's that progression over time. So that does it here for Megan, for session 10, right? And for Megan's sleep focus treatment in total here. So this brings us to the end of module 9, exploring the content here of those sessions for session 7 and beyond, depending on the needs of your own DBT clients here.